Hey, this is Dr. Joseph, and I want to talk today about a common injury that we see a lot in the winter here from skiing, and that is the sort of notorious ACL injury. The ACL is the ligament right here in the middle of your knee, and it's responsible for stability with rotary torque. And so a lot of patients, commonly from skiing and other twisting type sports, will have an injury where they twist this too far, and they'll often feel a pop. And that's never a good sign when patients come to clinic and say, I twisted my knee and I felt and I heard a pop. That's the big red flag. Typically the pop is the ligament itself that is breaking, and it tends to retract once it tears. When patients tear their ACL completely, then it often needs a surgery to fix it. If they tear their ACL partially, meaning a grade 1 or a grade 2, then we don't need to fix that. All that needs is time. But when it pops, it usually means that it completely tore. When ACLs tear, it's unusual that we can actually sew it back together. And that's why you hear the term an ACL reconstruction. And the idea of a reconstruction means we put in a brand new ligament. The healing time for the new ligament is about 6 months. So it does require a lot of physical therapy, and it requires patience on the patient that injures that. But it also is a very predictable surgery, carries at least a 95 to 96% success rate, and it's a good surgery. With younger patients, we tend to use their own anatomy, meaning we use either hamstrings, quad tendon, or sometimes patellar tendon to remake this ligament. If patients are more about 40 and older, then we'll often use a cadaveric tissue. Sometimes with younger patients, we'll still use cadaver, and cadaver tissue is very safe. There was issues in the past with the safety of it, and now it has become very acceptable and very safe, and it's a good surgery in the right patient.